Welcome to the Ann Arbor Public Schools Superintendent Update for the week of October 5th. We've had a lot of information that we've been sharing out over the last months, and we thought that this would be another good week to answer a bunch of the questions that have been coming in frequently. And so I'm going to start off right away with, we understand that at this time, that as superintendent, you have recently recommended, and the Board of Education last week confirmed the decision to remain in a virtual learning status. Can you share why you made this recommendation, Dr. Swift?
Yes, I appreciate the question. We reviewed our metrics in our AAPS COVID dashboard last Wednesday evening in public session with the board. There are really three concerns that we're holding right now. One is a significant trend upward in number of cases in Washtenaw County, and particularly that 2/3 of those new cases from the previous 2 weeks are right localized in our Ann Arbor zip codes. Secondly, the number of cases per 100,000, and then thirdly, the number of cases per million. Both of those metrics place us into a higher level of concern. And so at this time, we will remain in a virtual status. We'll continue to monitor this data daily and report out and update our dashboard weekly.
I know that the Ann Arbor Public Schools and you, Dr. Swift, you talk and participate in groups of other university town school districts from across the country. Can you share what is the current status of other public school systems in similar cities across the Midwest and across the country? Because we know university towns have unique circumstances that don't align in other communities.
Well, that's correct, Andrew. We belong to a group of school districts. It's a consortium of school districts who, like us, are situated in university towns across the Midwest and the Northeast, and really across the country. As we review those towns and those school districts at this time, they are, like we are, in a virtual education status. We do understand the complexities of having the university case data in our community data, and yet we also understand how very porous our community is and how many connections we have. And so we'll continue to monitor that distinction between the community data and the university data. And yet at this time, it is the guidance that we're receiving that we do include that data. That is our Washtenaw County data in our assessment of where we are with our community rate of infection.
As you mentioned, the university and particularly the large number of students on campus do skew some of the numbers. A lot of people in the community are questioning, should the university students, particularly those aged 18 to 22, actually be included in the data that Ann Arbor Public Schools is looking at? Why are we deciding to include those students in the analysis?
Well, absolutely. Our top priority remains the health and safety of our students and staff, our parents and families and community. Our association and connections with the University of Michigan and with Eastern Michigan University are numerous. And so at this time, we do watch that Washtenaw County Health Department data that's published for our county. And we continue to work closely with our health experts, our public health experts, and in considering when we could potentially return to in-school learning. At this time, it is the guidance that all of that data is our community data. And for example, we compare ourselves even to Lansing, and their situation is a very similarly situated university town. These public school districts by and large remain in a virtual status. We are continuing to look at our community data. And we'll continue to monitor this. And if it were to be true that over the coming days and weeks, our universities are able to contain that data for students or for young people aged 18 to 22, and it remains separate from the other age groups, that will be wonderful news, and we'll include that if we're able to see that occur. Andrew, we are hearing from some of our experts the concern that opening of public schools could actually be a concerning bridge between that town and gown data. And so this is an excellent question that we'll continue to observe and analyze as we move forward. I think you noted, Andrew, over the weekend that the University of Michigan did see one of their triggers occur in their dashboard data. And I have heard from President Schlissel that they will be reviewing the analytics across the university, reviewing their operations, and may be making some adjustments. So we'll continue to engage in that conversation as to how it impacts really this unique picture of Ann Arbor Public Schools and our situation in a university community.
This is the superintendent update for the week of October 5th. And we have Dr. Swift with us answering many of the most frequently asked questions that we've been hearing. Obviously, a issue that is different for each an individual family and student is sort of the risk and benefit analysis. And it's particularly for students that have been really struggling with virtual learning, whether that's students with individual education plans, English language learners, and some other students with some specialized challenges. What is being done as we're looking at, their impact being greater than other students?
Well, we absolutely are continuing to monitor the progress of each and every student in this virtual learning environment. We recognize from the outset that virtual learning will pose greater challenges for some students than for others. And certainly we're aware of that. So at this time, we are working vigorously to provide additional supports. And Andrew, these students may be students who have an IEP or a 504, specialized learning needs of that nature. They may be students who are English language learners. They may be students who are impacted in a variety of other ways. And so we are busy right now, as we are every year during the end of September and the beginning of October. We're vigorously working to provide additional supports. So folks will see us creating small groups of students, and those students will be receiving additional supports that may be delivered virtually, and also some supports that will be delivered in a face-to-face model. We consider this the critical and essential work, a part of our overall critical work during this pandemic, and we will continue to move forward in these areas. I do want to point out also that when we move to our next phase of a hybrid learning model, our students who normally receive their education in very small groups, our students with very high levels of impact, these will be students who will have greater amounts of face-to-face learning time in the buildings. So it's very possible in a hybrid environment that some of our most impacted students will receive 4 days, 3 or 4 days of in-school learning, as opposed to the 2 days of in-school learning that most of our students will get in a hybrid model. Thirdly, I wanted to point out that just as we did this past summer, we had 5,000 students engaged in a summer learning program. We had 500 of those students were students with special needs who received recovery services throughout the summer session. That kind of approach will continue over the summer of 2021. We see this work to add supports and to ensure recovery and support services as an ongoing process. So we're vigorously on that now, and we will continue to be over the coming months. We know this is a long game, and we're going to continue to work with our students who need the most so that they have supports available to them.
Okay, that's some very useful information for some families. One area that will impact all families is the review of the infection data. We released last week the dashboard after the board had formally approved. We'd been looking at those metrics, of course, for months leading up to that, but that was the formal adoption last week. What is the process going to look like going forward? And I think probably most importantly, when can staff and parents anticipate seeing updates on that information?
We're so pleased to have our AAPS COVID metrics dashboard published. We've been working with metrics, as you shared, Andrew, week after week, month after month, since March, and yet we've settled on a set of metrics. Just a reminder that no single metric drives the decision. We really are looking at the overall picture of the COVID pandemic and what we're learning as we move along. We will now be updating that dashboard every week. So I noticed, Andrew, on our website that you have the 2 previous weeks there already now, and we'll look forward to our next update here in just a couple of days this week. As that dashboard is updated each week, if we see an improvement in our progress to the point that we're approaching those metrics, we would communicate publicly with our AAPS staff and team, with our students and parents. We would do this in a written communication and do this at a public meeting of the board to say that we're achieving our metrics. At that time, we would want to see those metrics hold. The typical guidance is for about 14 days. So during that time, we would set an opening date. And as we've discussed a lot, Andrew, that is a staged transition that begins with our kinder, first, and second students. We would welcome those students into a hybrid learning model, which means they would be in school about 2 days each week. So we would be able to do our social distancing with much smaller classes. And just a reminder that no students will be compelled to return before they are ready. We know every family is unique. So our families will be able to remain in a virtual status if they feel that's best for them. So we would set our date and begin the staged transition, lower elementary, upper elementary, and then begin to consider secondary.
Okay, so we've laid out the roadmap to how we're going to be able to bring kids back into the schools. Is the plan to wait until we know that we're good to make the changes in the physical properties? Or have we already been making some changes inside our schools to get ready to come back once the numbers say that it's okay to do so?
We've been working vigorously on our properties for months now to ensure that we would be ready for a COVID-informed return to in-school learning. So I'll highlight just about 3 areas, Andrew, and I know we're all looking forward to a more comprehensive report coming from our facilities directors in October, here in just a couple of weeks. We've been working on our water quality. So weekly flushing of the plumbing systems, and this helps prevent E. coli and Legionella bacteria, which causes the Legionnaire's disease. We've been conducting testing at each school for Legionella and E. coli based on our CDC guidelines. We've worked on those drinking fountains and removed the drinking fountain bubblers so that we really are using an approach with the drinking fountains that is touchless and that is also not having any individual consume water directly from the fountain. We're also converting all of our restrooms into a touchless operation. Now, that's an ongoing project that will take a little more than a year, but we're already on that project. So first area really is about water safety. We know that is very important. Another area we're working in is the social distance preparations for our buildings. So the sneeze guards, those clear barriers, have already been installed in all of our school offices and in other locations where folks need to be in close proximity to each other in communication and yet need that extra barrier of protection. Now in progress, each of our principals is working with our facilities team. We have the signage, the floor signage, and the signage for our buildings ready, and that will be positioned uniquely in each building, just like it is when you go to buy your groceries, so that folks know, our students and everyone, our staff, everyone in our buildings know how to properly social distance when they're passing in the hallways. We're also designating the maximum occupancy for spaces such as restrooms and elevators, our media centers. There will be some conference rooms that will be closed through the duration of the pandemic. We'll have those kinds of meetings in a virtual status to ensure health and safety. So that in addition to water is our physical work in the buildings to ensure social distancing. I also want to touch on the area of indoor air quality. We know this is a very big concern among all of us, is to ensure that the gathering of individuals indoors is done so in the safest and healthiest way possible. So we have been very busy replacing our air filters throughout our buildings. We are maximizing the air filtering systems and increasing the filter density where that is possible in our buildings. We're also, we have designed a new algorithm for the processing of indoor air across our buildings that allows for 40 to 100% outside air mixed into that indoor environment. And that will be regulated based on the heating demand in colder weather. But that idea of increasing outdoor air and improving that indoor air ventilation across every building in our system. So, Andrew, those are just three highlights. And again, our facilities team will be sharing more specific details here in just a few days in a presentation. I know there's also a presentation that you'll note here today that was shared last week. So folks can already access that if they would like to learn more detail about our work to ensure that our buildings are prepared.
Well, that's great to hear, Dr. Swift, that we've got a lot going on inside the buildings. We're not just relying on the numbers coming down, although, of course, that's a very important thing for everyone in the community, is to see these numbers getting down fewer cases will be better for everyone in the community. Thank you very much for answering some of these big questions today, Dr. Swift.
Well, thank you, Andrew. I appreciate the opportunity to visit directly with our students, our parents, our AAPS team, and our community. We know each of us has a role and a responsibility to play in ensuring that we're doing everything in our power to reduce our community infection rate. So we know it by heart, but wearing our mask, watching our distance, practicing that hygiene that we know is so important. We understand that we're coming into the beginning of flu season and that it is going to be critically important that we, each and every one of us, do our part. We absolutely look forward to having our students back in school learning with us in person. And we know that we can improve these rates if we will continue to practice these basic COVID habits, health habits that we know are so important. I want to thank all of our students and parents who've taken time to respond to our survey. We put it out on Friday, and I understand today, Monday, that we have about 4,500 responses already. So we really appreciate all of you who are taking the time. Our continuous improvement process is that we receive feedback and input from our parents and students and staff and community, and we use that feedback to improve our work moving forward. We so appreciate the understanding and the hard work and the support of our students, our staff, our parents, and our community. We are making progress as a community to navigate this COVID pandemic together. And I appreciate each and every one of you and all that you are doing to support our students and our staff and our community as we move forward together. Thank you for the opportunity to join you today. I know we'll be back in touch in a couple of days with some more emerging information from the Ann Arbor Public Schools. Thank you.